Welcome to the fourth and final module of PHE Canada's Health Promoting Schools Learning Program. In this final module, our objectives are to review the key concepts we have discussed and to bring together key resources available to interested school networks to support your plan to implement a comprehensive school health approach. PHE Canada understands that creating change can be challenging, and having both a process to follow and a supporting network to help sustain your efforts is required. Let's quickly recap the key learning components that we've discussed to date. In earlier modules, we discussed the framework for a health-promoting school, a healthy social and physical environment, a caring school environment where policies are fairly and consistently applied, and where the physical surroundings support healthy living and optimum learning. Teaching and learning programs that integrate healthy learning and skills into the wider curriculum. Healthy school policies that reflect health living principles. Partnerships and services developed with members of the school and broader community to support and augment a healthy school approach. In order to be successful in adopting a healthy school approach, schools must use evidence-based planning to identify your school's unique health needs. Engage champions who truly believe in a healthy school approach. Have school leadership who actively guide planning, implementation, and evaluation processes. Seek broad input from students, families, staff to ensure their needs are reflected in policy and planning. Use a defined planning process to engage stakeholders. Focus initiatives on opportunities and needs. And be committed to evaluate what is working, adjust and refine plans accordingly. Health-promoting schools have taken root across Canada. The Joint Consortium for School Health has participating members involved in numerous programs in virtually all provinces and territories. The initiative is led by the Public Health Agency of Canada, and each school has its own unique vision of how to focus its healthy school approach. Let's take a look at some of the initiatives underway. Both BC and Alberta have been actively pursuing healthy schools initiatives for some time. BC's Healthy Schools, BC, and Action Schools offer online library tools, online resources, and school success stories. In Alberta, Ever Active Schools, the Alberta Coalition for Healthy School Communities, and Apple Schools all offer valuable resources and showcase the results they have achieved. Just click on the links to find out more about these organizations and access their resources. Schools in Manitoba, Saskatchewan, Northwest Territories, and Yukon have also adopted a healthy schools approach. The details of specific programs are available by clicking on the related link. Ontario and Quebec have also developed a focus on creating healthy schools. For ideas and sample programs, check out the links for each province. All 4 of the Atlantic provinces have implemented healthy school initiatives. Check out the links to get their detailed information and resources. Prince Edward Island is home to the Joint Consortium for School Health and also the Comprehensive School Health Research Group based at the University of Prince Edward Island. Its goal is to build capacity and conduct high-quality, policy-relevant school health research working with other learning institutions and partners across Canada. JCSH offers a number of valuable tools and ideas to assist schools in pursuing a healthy schools approach, including the Healthy School Planner Assessment Tool. PHE Canada's vision is that all children and youth in Canada are living healthy and physically active lives. Its support for health-promoting schools is reflected in the organization's mission and demonstrated in the support it offers to interested schools. PHE provides program advisory assistance and acts as an advocate for physical literacy and health. The organization also offers practical healthy school resources and a facilitated process to help interested schools network and plan for adopting a healthy school approach. The process for successfully creating a health-promoting school includes defined steps. First, establish your diverse planning team. Work with your team to assess your current situation. Seek out like-minded schools with whom you can network and expand capacity by creating a learning community of practice. Establish your network. Ideally 8 to 10 schools working together to support each other's efforts, share challenges and best practices, and gain collective courage. PHE Canada is committed to support your efforts. Our facilitated process can help jumpstart and support your project for rapid implementation. If you decide to work with PHE Canada's Health Promoting Schools process, step 1 is to create your planning team. When selecting your team, look for representatives that reflect the whole school. Faculty, school service staff, school leadership, parents, community members. Since a health promoting school integrates learning across the curriculum, be sure to include both health and education expertise, and involve teachers from other disciplines. If yours is a junior high or high school, seek to include 1 or more student team members. They can provide valuable insights as well as increase engagement of other students. Ideally, your team should be 7 to 10 members. That is small enough to easily coordinate schedules and large enough to effectively share the workload. As we have discussed throughout this learning program, evidence-based decisions are vital to the health promoting school's success. In advance of your facilitated planning workshop, you will need to gather available school health statistical data about your school population. Ask planning team members to individually complete the Joint Consortium for School Health Healthy School Planner. This will ensure that each person has had an opportunity to assess your school's current situation. Schedule a 1-hour meeting to complete the JCSH Healthy School Planner together. This allows for different perspectives and rationale to be shared, with the ultimate goal of reaching agreement on the team answers to the assessment questions. This requires that one person facilitates the discussion and a second team member enters the team response to the online assessment. Now your team is prepared for the facilitated planning workshop. The goals of the facilitated process are to share PHE Canada's and other resources available to your school network teams, to review the comprehensive school health framework with your school teams, facilitate the planning process as teams apply the CSH framework. Guide your assessment of the current situation and creation of a vision and a plan for your healthy school. Having worked through these critical initial steps together, you will have started to build your community of practice. Following the facilitated workshop, your team is ready to build out your detailed plans and activities. Schedule a follow-up with your community of practice members. Depending on distance and/or resources, these can be face-to-face, by video, or audio conference. Whichever method you choose, strive to keep the conversation focused on shared learning and celebrating success. Then it's on to implementation. Be sure to measure your progress, share with your school and community of practice, and celebrate success. As with most plans, to maximize success, adjustments will need to be made in response to measured results. Creating and sustaining a community of practice makes it easy to share learning about what is working and make quick adjustments. An important first step to create a health-promoting school is getting folks on board and involved at the very beginning of the process. PHE Canada is ready to help you and your school team get off to a fast start in adopting a health-promoting school approach for your school. Thank you for participating in this e-learning program. If you need help getting started or are simply interested to learn more, please connect with using the link on your screen. This e-learning module has been brought to you by Physical and Health Education Canada with the generous financial support of the Lawson Foundation.